Good evening and welcome to the February edition of the Business Forum. Happy Valentine's Day to everyone, and a special shout out today to Ruckle Middle School and Dr. Paul Whidden, their principal, as our School of the Month. So if you see them in passing, make sure you pat them on the back, shake their hands, and tell them what a great job they're doing taking care of our children. First up this evening, we're going to have our second Wednesday breakfast sponsor, the Manor at Blue Water Bay. And representing the Manor at Blue Water Bay is Teresa Halverson, the Director of Admissions and Marketing, and Matt Baltz, Administrator. Welcome.
Good evening.
Thank you. Good
It's been
morning.
so long. I haven't seen you guys like in a month.
Since last year.
I know.
Last year, that's right. It was last year. Tell us a little bit about what services the Manor at Blue Water Bay offers.
Well, we're a 120-bed, full-service skilled nursing facility, home to a lot of folks, long-term care, traditional long-term care, but a lot of our business is also rehab, and these are folks post-hospitalization or elective surgery that come and work with our nurses and some of our fine therapists, and eventually, I say eventually, within 3-4 weeks on average, back home living their life better than they were before they came to us.
Sure. I guess a lot of that rehab is either an injury or maybe a joint replacement or something along that line. And the nice part about being with you guys is everything's structured and they get their PT, and it usually makes them get back to the world a little faster, doesn't it?
Definitely. We, of course, manage their medicines for them. Post-surgery, that's a challenge for a lot of folks. But the physical therapy, the occupational therapy, speech therapy, definitely accelerates the timetable, the recovery timetable, as opposed to the other options out there, which are home health or using outpatient clinics or paying privately for a caregiver. Most of our folks have their Medicare benefits, and it's definitely the best thing, and we're proud of the way we recover people, rehab people, and send them home.
Sure. And I would think that the better they do early on, the better they do throughout the remainder of their lives, isn't it? Isn't there kind of a window there where you really I did a knee replacement, and I know the harder I worked on the rehab of my knee replacement, the better off I was in the long run. It seemed like mobility and range of motion and all that really mattered early in the process.
Very true. There's no sense in going to get a new part and then not fully using
Exactly.
it. You can maybe take away the pain of the old knee, but if you don't get that whole leg or your entire body as strong as it can be, you might end up, working on the next knee or the hip because of something ergonomically not going right, and you're back looking at another joint replacement.
Oh, Lord. Well, and I know you guys are doing a wonderful job there. Are there any new services that you plan on offering this year?
Yeah, we actually are. We have contracted with a wound care physician recently that comes in and sees all physicians that have any kind of surgical wounds or, just generalized wounds, and that's been an added benefit. We also have a geriatric psychiatrist that comes in to see those individuals that may have a certain need. And our biggest thing that we've added in the last few months is a virtual rehab program. And that's kind of exciting for our rehab patients. It's kind of like the WE program. Most people are familiar with the WE program. It's interactive. This is designed for patients with physical and cognitive deficits.
Oh, wow.
It can work on, if they've had like a stroke, can work on cognitive deficits, fine motor skills, balance, coordination. There's games they can play, and it's very virtual. And watching some of the patients play that, it's fun for them.
Sure.
But they're also gaining, more independence and strength and coordination through it. So that's one of the added benefits that we have.
Absolutely. Matt, are you seeing any new trends in healthcare?
Of course, there's a lot of advancements. Some of the joint replacements have advanced where their recovery is actually a lot quicker, whether that be a anterior approach to the hip or the way they're doing shoulders now. So there's always something going on, and then of course when you get into medicine, there's of course always new medicines for this, that, or the other. Figuring those out, we leave that up to the doctor for the most part, but it's always changing. This is our busy time of year, cold and flu season. Get your flu shot.
Amen.
A lot of elective surgeries. People kind of make it through the holidays and then they decide I'm going to go get that done or get that hip done or shoulder done. And
It's the cold months, a little less active, so it's the time to
yeah,
get those
they
things
want to get
taken care
that
of.
done before spring, and of course, we encourage folks to come and pre-register.
Yeah.
If they're going to get that surgery done, come see Teresa in advance of that, just so we can
Make sure you have room and
iron things out,
Sure.
and have room, and kind of have you on the books and able to accommodate easier, because we do remain full this time of year, but we want to
Yeah.
accommodate and service the community the best we can.
Very, very good tips. Teresa, what makes the Manor different from other facilities?
Well, I think it's because we are locally owned. We've had the same owner and management for over 20 years, a lot of the same staff, and our survey history. We're a 5-star facility. We're always looking how we can improve ourselves. And I just think the general services that we offer, the continuity of care in the community, partnering with other agencies like ALFs and
Sure.
home health agencies, and the physicians to provide the best care for our patients.
As an insurance guy, you well know that I have a lot of long-term customers that one way or another end up coming in, and I have to give you my seal of approval because you certainly have
Thank
done
you.
a wonderful job of taking good care of them, and I've always been proud of the job that you guys do. What type of patients do you typically see this time of year?
Right now, we're seeing a lot of total joints. I think people wait till after the holidays, the first of the year, with their Medicare, and they're getting their hips and knees. And we also are seeing quite a few pneumonias this time of year with the weather change. So that kind of keeps us very busy right now.
How is the stay for a patient covered at your facility?
We are a Medicare and Medicaid provider, and we also partner with about 30 or 40 insurance companies. Medicare is obviously the biggest payer, the traditional Medicare. If a patient comes in post-hospital, the Medicare covers it at 100% at least the first 20 days.
Oh, sure.
Yeah.
And I guess you guys are really active in that process to make sure
Very active.
you mine as much coverage as possible
Right.
to keep out-of-pocket expenses to a minimum.
Right. Yeah, we
And-
work with the patient on that.
Yeah, absolutely. And then also making sure that all of the things that need to be taken care of are taken care of. I can't stress that enough because after my knee replacement, doing it at home wasn't the way to go. It just seemed smarter to go and be in the hands of professionals who have done this for many people and know all of the problems. You know, I get afraid because something happened to me, but it's a normal course of events, and a professional would know all that. So,
Right.
I think the best thing that I can say is that your facility is so much like home. It's just a really nice place to be. There's good people, good staff, and that makes it that much more comfortable. So I want to commend you on all that
thank
you're
you.
doing it for our community, and I look forward to many years of this partnership. And you guys are our February 2nd Wednesday breakfast sponsor. I guess that's going to be February 10th at 7:30 a.m.
Yes, sir. At the community center in Niceville.
Niceville Community Center right there on Parton Drive.
Right.
And if folks wanted to get in touch with you about the Manor, how would they do that?
They could call us at 897-5592. Ask for admissions. We'll be glad to help them, answer any questions, provide tours, pre-register them for their surgeries. Anything we can do to help.
Sure. Teresa and Matt, thank you very much for all that you're doing for our community. You are certainly a wonderful resource, and we look forward to many, many years together. God bless you both.
Thank you.
Thank you, Dave.
Stay tuned. You're going to want to hear what the annual multi-chamber business expo is all about, so don't go away.